Hello everyone. Today I'm going to talk about two curious topics. The first one is immunotherapy in renal cell carcinoma. Definition: immunotherapy with a checkpoint inhibitors is now considered a standard of care for frontline treatment of advanced renal cell carcinoma. Despite better outcomes with these agents, there is still room for improvement.
Renal cell carcinoma is the most common type of kidney cancer in adults. It accounts for approximately 3% of adult cancers, and the incidence has risen steadily by about 2 to 4% each year in the past few decades. It is effectively a collection of different types of tumors, each derived from the various parts of the kidney cell and displaying salient genetic characteristics, histological features, and, to some extent, clinical picture. When it metastasizes, it has the tendency to spread to the lymph nodes, lungs, liver, adrenal glands, brain, or bones. While the exact cause of renal cell carcinoma is unknown, there are risk factors that increase the chance of developing it, such as smoking, high blood pressure, family history of kidney cancer, and obesity. The chance of developing renal cell carcinoma increases with the age, and males have double the chance of having it compared to females. In a lot of patients, this cancer may not produce any symptoms for most of its course. Only about 10% of patients present with the classic triad of flank pain, blood in the urine, and lump in the abdomen. Other signs and symptoms may include unexplained weight loss, fever, night sweats, weakness, fatigue, nausea, and high blood pressure. Renal cell carcinoma is associated with a number of paraneoplastic syndromes, which are conditions caused by either the tumor hormones produced by the tumor or by the body's attack on the tumor. In about 20% of these patients, paraneoplastic syndromes are present, such as high blood calcium levels, high red blood cell count, high platelet count, and deposition of amyloid protein in one or more organ systems. To diagnose renal cell carcinoma, signs and symptoms and past medical history play significant roles. Based on the symptoms and signs, a range of biochemical tests are considered to provide sufficient diagnostic clues. Kidney imaging is vital, mainly consisting of ultrasound, CT scanning, and MRI scanning of the kidneys. Biopsy of the suspected kidney mass helps confirmation of the diagnosis. To evaluate the extent of cancer spread, PET scanning is the standard imaging modality. The therapeutic approach to renal cell carcinoma is guided by the stage or degree of tumor spread, pre-existing medical conditions, and overall health and age of the person. The principal treatment options for renal cell carcinoma consist of surgery, immunotherapy, and targeted therapy. Partial or complete removal of the affected kidney is the standard treatment for localized renal cell carcinoma. Immunotherapy, or biologic therapy, works by boosting the body's immune system to help destroy cancer cells. Cytokines are the artificially engineered versions of natural proteins that activate the immune system, and the ones most often to treat kidney cancer are interleukin-2 and interferon alpha. The targeted therapy works by blocking growth of the new blood vessels that nourish cancer cells or downplaying important proteins in cancer cells that help them grow, or both. Clinical response rates with chemotherapy, either monoagent or combination, are usually less than 15%. Renal cell carcinoma is not very sensitive to radiation, and radiation therapy is more often used to palliate or ease cancer symptoms in case of cancer spread. For more information about list of expert doctors, hospitals, and on
Okay, what is the importance in medicine? Renal cell carcinoma is the third type of urologic cancer and has poor prognosis, with 30% of metastatic patients at diagnosis. Pros and cons. In the first, pros. The robust activity of first-line immunotherapy in patients with renal cell carcinoma has raised for the bar for future therapies. Cons. However, long-term response are rare with a high rate of resistance. A little clinical case.
The following is a CT scan of the abdomen and pelvis performed with intravenous contrast. We'll start at the lung bases and scroll inferiorly. As you scroll inferiorly, we can see that there is an exophytic, predominantly solid mass arising from the upper pole of the left kidney, compatible with the renal cell neoplasm. There is an additional mass in the left kidney seen more inferiorly. However, if we observe its density value, and in fact measure its density value by putting a Hounsfield unit over this, we'll see that it measures simple fluid, somewhere between -20 and 20 Hounsfield units, thus indicating that it reflects a simple cyst. As we scroll through the right kidney, we can see that in the interpolar to lower pole region, there's another simple cyst. However, there are no solid masses arising from the right kidney to suggest a renal neoplasm. On these images, we can observe some of the vasculature associated with the kidneys. On this image, this is the aorta, this is the IVC. As you scroll downwards, we can start to see the left renal vein, and notice how the left renal vein travels anterior to the abdominal aorta as it joins the IVC. We can also start to see both renal arteries, right side and left side, and we can follow these vessels to the kidneys. This vessel over here is the gonadal vein, which on the left almost always drains into the left renal vein. We can follow this as we scroll upwards again. We can also see the collecting systems, which join to form the renal pelvis, and subsequently the ureters as they course inferiorly to the pelvis. This is a coronal CT scan of the same case. We're going to be scrolling from posteriorly to anteriorly in this case. So as we go from posterior to the anterior, the posterior most structures, we're going to start to see the spine, some of the ribs, some of the bones, and then we'll start to see the kidneys. Once again, you can see an exophytic, predominantly solid mass arising from the upper pole of the left kidney, compatible with the renal cell neoplasm. On this image, you can see some of the left collecting systems, which will join to form the left renal pelvis. As we scroll, we can also see the left renal artery, as well as the left renal vein, which drains into the inferior vena cava.
Issue applied in Ecuador. There is no adequate availability in our market. It is not covered by the state. In conclusion, the prevalence of renal cell carcinoma is low in Ecuador. However, immunotherapy is shown as a target on specific treatment that involves faster recovery, longer survival, and fewer adverse effects. The second one topic is ribavirin for chronic hepatitis E virus infection in transplant recipient. Definition: hepatitis E is caused by an enteric transmitted RNA virus and causes typical symptoms of viral hepatitis, including anorexia, malaise, and jaundice.
Hey, thank you for watching Medicosis Perfectionalis. Hepatitis E mnemonic. The E mnemonic, also known as the EU mnemonic, coming up. Hepatitis E. Remember, EU. It causes jaundice in the Far East, Egypt, and by Egypt I mean Africa. And by the way, Egypt is my home country. India, Central America, contaminated water, ew, contaminated is ew, undercooked seafood, Sometimes some genotypes of Hep E are endemic in the swine. So undercooked pork can cause Hep E hepatitis. So swine, pigs eat everything including garbage and worms, so that's ew. No offense to pigs. Fecal-oral route of transmission. Sometimes it's common in pregnancy. And when it comes to pregnant women, it's fulminant. Fulminant means massive necrosis, which can lead to failure. Ew. And there is marked cholestasis in hepatitis E. Mostly it's acute. In these countries, sometimes it's the most common cause of acute viral hepatitis. Wow. But, however, it also can be chronic, such as patient with HIV or patient with immunosuppression. Some textbooks, including Harrison's, which is my favorite book, I will link it in the description, it regards Hep E as an opportunistic infection for people with HIV. So, acute will have IgM antibodies in the blood, and chronic will have anti-HEV IgG. It's very similar to Hep A on electron microscopy. To remember that A and E are both vowels. Okay? Remember Hep D was dependent on whom? On Hep B. So you can draw D like this, and you have B, and A and E are vowels, so they go together, and these go together. Anyways, so that's it. Now you know everything you need to know about hepatitis E. But wait, there is more. And now, question of the day. Which type of hepatitis is the most commonly associated with sexual exposure? Is it Hep A, Hep B, or Hep C? By the way, if you go to my Facebook page, there is an album there, contains all of the questions. This is the 4th question, so if you need to get them all, go to my Facebook page. Now, all you need to know about Hep E. Please go ahead and enjoy the rest of the day, and I'll see you later. Thank you very much.
Importance in medicine. It is generally of good prognosis, causing symptoms such as anorexia, nausea, vomiting, fever, and jaundice. However, it can be serious in pregnant women, increasing the risk of death.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HIV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
So I hope you liked this video. Absolutely.
Hi, I'm Cheryl Dale and I'm a nurse practitioner in hepatology. Today, I'm going to talk about PEG interferon and ribavirin for the treatment of hepatitis C. You can visit our website www.liverinfo.com and print off a copy of our PEG interferon ribavirin pictopamphlet to follow along with this video. PEG interferon is also known as Pegasus or Pegatron. PEG interferon is taken by an injection under the skin just once a week. A nurse can teach you how to give the injections, and a friend or a family member can also help with your injections. Ribavirin is taken in a pill form twice a day. There are 4 things you need to do when taking PEG interferon and ribavirin. You should discuss these with your doctor. First, it is important to get regular blood tests. This is to make sure the medicine isn't affecting your blood counts. Second, alcohol can interfere with PEG interferon. It is best to avoid all alcohol. Third, PEG interferon can make it slightly harder for you to fight off infections. It is best to call your doctor or nurse if you develop a fever or think you have an infection. And finally, don't get pregnant or breastfeed while taking PEG interferon and ribavirin. Ribavirin can harm an unborn child. The most common side effect of PEG interferon is flu-like symptoms, such as feeling unwell, feeling tired, having a low-grade fever, chills, achy muscles and joints, and headaches. This is common within the first 1 to 2 days after each injection. PEG interferon can also cause a skin reaction at the injection site. Let your doctor or nurse know if these become severe. Some people also feel generally weak and tired throughout their treatment with PEG interferon. PEG interferon and ribavirin can sometimes cause a loss of appetite and weight loss. Let your doctor or nurse know if any of these side effects become severe. Let your doctor or nurse know if you feel irritable or anxious, or experiencing worsening of depression or thoughts of suicide while taking PEG interferon. Also, tell your doctor or nurse if you develop shortness of breath or chest pain. PEG interferon has rarely been associated with thyroid and blood sugar problems. Your doctor can look for these with a simple blood test. Finally, PEG interferon and ribavirin very rarely cause a rash or thinning of the hair. If you're taking PEG interferon and ribavirin, you should call your doctor if you feel sick and want to stop, if you're concerned about any side effects, or if you've stopped or want to stop the medication for any reason. There are other specific reasons to call your doctor or nurse. If you have chest pain or shortness of breath, if you feel depressed or have thoughts of suicide, if you become pregnant, if you have any changes in your vision, and finally, if you develop a rash. I hope you found this video to be useful. For more information, please refer to our website, www.liverinfo.com.
Pros and cons. Detecting hepatitis E can be simple. It has good prognosis with correct management. Cons. It can cause fulminant hepatitis in severe case. Issue applied in Ecuador. It is very common in Ecuador due to the lack of Eugene Messeris. In conclusions, hepatitis E is an infectious liver disease with an excellent prognosis, but special care should be taken in a pregnant woman and patients with previous liver disease.